is designed for optimized performance. And for the same, I would request Mr. Nitin Pandey, Head Healthcare Transformation Services, Philips India, to kindly join us up on stage.
It's good to follow up a panel discussion. Everybody's thinking, some active minds. Next 15 to 20 minutes, I'm going to take through Philips' capabilities on infrastructure and consulting, essentially hospital design and equipment. So Philips has been in the Indian healthcare industry for more than 3 decades now, and it has been known pretty much well across different types and segments of hospitals as a market leader in innovation and high-end equipment. And as a company, we have grown quite a lot, and we have had a fair share of experiences of learning from our stakeholders, from our clients, whom we have provided medical equipment. We keep on listening very patiently, and while doing so, we come across a lot of experiences that help us think beyond equipment. And that is on the lines of what challenges our clients are facing on a day-to-day basis. And that led us to develop an in-house capability to help our clients answer all those challenges, answer all those queries, answer all those, and solve all those problems which they face while running a hospital, constructing a hospital, and even while they are trying to commission a hospital. So on those lines, we at Philips have developed an in-house capability, and that has been operational for more than half a decade now in India, which we call as the Philips Infrastructure and Consulting. Lindsay earlier today had pointed out about the continuum of care, which talks about how hospitals on a day-to-day basis have their fair share of challenges across. And that leads to all those problems which come up, which helps us learn more as to how to solve them. And that's what we focus on, is the continuum of care across our healthcare facilities. So as an essential part of it, we at Philips do a lot of data analytics. We do optimization on the kind of experience which the patients have in our facilities. We obviously are into strategic design, which takes a cue from the vision and goal of the client who wants to construct a hospital. If it's a brownfield hospital, what we can do to optimize, which was a part of the panel discussion earlier as well. Clinical optimization, we work on co-create methodology, which we use to bring on panel all the in-house stakeholders, all the Center of Excellence chairmen who work in clinical specialties to bring on table what all we can do to optimize the workflows. And obviously, we have been pioneer in the connected care, in the technology part. Here is the quadruple aim of Philips Healthcare. We have been focusing a lot on the equipment, but along with that thought, we have focused on all the essential aspects of care which impact the quality and the outcomes. The core obviously is the clinical excellence, which every hospital strives to achieve and have all the indices which focus on the clinical excellence to the top, including death on table rates, success rate of surgeries, lesser number of readmission cases and all. Operations efficiencies, which go hand in hand to govern the running of and functionality of a hospital. The technology innovation, which obviously takes care into what is the next requirement into hospital operations, which technology can solve. And obviously the experience personalization, which I just mentioned is a very niche facility available with Philips, which we call as the ambient experience. So Philips Infrastructure and Consulting is present in more than 19 markets globally. More of the concentration is towards the Northern America, Europe, where our headquarters are, for the Indian subcontinent also, and in the Middle East. Talking about the team formulation which we have to deliver all the capabilities which I just spoke about, we have people ranging from the most first part of the project consulting which we take care of in terms of feasibility, in terms of the financial modeling and all. And you can probably think of us as a one-stop shop for all the possible consulting work you can expect, right from the concept and conceptualization of the thought of opening up a hospital till the time you actually open up a hospital. And in the meanwhile, in this entire journey, we have on board people who can work on financials, can work on financial modeling. So there are solution architects, there are people who understand finance, there are program managers, there are architects, there are MEP consultants, there are doctors, there are trained module consultants who work on medical equipment hardcore day in, day out. Everybody comes together to provide the best possible, and that too with an immense amount of experience and exposure at a global level, to give you that kind of experience and consulting which you can expect from a brand like Philips. So this is our approach. How do we take up a project to start with? We help identify sites which a client would need and would want to open up a hospital in, which involves the catchment area analysis, the assessment of how the population, the demographics are behaving, what is the payer capacity, the existing hospitals in the catchment area, the competition analysis that we can do, what to exclude from our plan of constructing a hospital, what kind of specialty mix you should have, which level of care you would want to open up within a given budget. All these things come up in this segment. And also we do study the disease patterns, which is very important to understand what would be a major footfall driving specialty in your hospital. And that too, in that particular specialty, what level of care would you want to govern? And that eventually has a throughput to kind of medical equipment planning, the spatial planning and everything, which I'll be just covering in a minute. So, deriving from the inputs which we get from all the analytics that we do for the catchment area and also the financials, we come up with a clinical service model, as I was talking about, what specialties you would want to have in a hospital, and what level of hospital you're going to open up. So what are the care, tertiary care, which is going to be in your hospital. Obviously, it's derived by the budget constraints which you would have, but in that particular finance limitation, what all you can pick off, which excludes the population, which does not directly maybe put in line with that existing hospitals in that area, which would also take care of the efficient footfall management and also availability of clinicians to be hired later on to meet all those specialties to be given in terms of surgical capability and also clinical capability. Then we do a capacity plan. Capacity plan would include the number of beds and the obvious mix of the critical care beds to the ward beds, the step-down care, and the right mix of emergency, right mix of transplant units if you want to have that, daycare beds, and also all the support areas which would cater to all these major areas like radiology and the lab. The right kind of resource plan to assist in functionality and total governance of all these areas which you would be running as a specialty unit. And also a well-built financial model, which essentially, as I was talking a bit earlier, was into how you could have a lesser break-even period basis of maximum optimal utilization of the equipment which you would be having in-house, and also how much can you derive in terms of the occupancy levels in your hospital, and as a throughput, how many can you optimize in a surgical load, how much you can optimize as a medical load, and drive that particular center of excellence as a sub penal inside a bigger penal of the hospital and the financial network. So that all eventually contributes to the larger financial stability. Now, so this is one example of what we do, which I was pointing out earlier, is the co-create workshop. And this is an essential part of the planning phase, in which we bring on board all the experts, especially the clinicians and the paramedics, who understand the operations and the challenges they bring on table, entirely on table, which helps us understand and map exactly what conflicts would be there in terms of lines of treatment, in terms of lines of operations, and what all you can do to best lay down the path to create that workflow, which will eventually culminate into a design, a concept design in your hospital for that project. So once that co-create workshop gives you an output, you take all those as an input and make a master plan in which in that entire area, what different blocks, if you would need for that matter, would come up, what should be the traffic flow, where all should your patient movement would be between different blocks, and that translates into the efficient space program and a stack plan in which you would be having a clear understanding of on what levels, what all services would be there. And that would be in order to optimize and optimize the resource utilization by minimizing the travel time, by minimizing the time, the transit corridors, streamlining the areas of clean and dirty utility item travel. And also apart from the touch points that we derive from the co-create and use to prepare all the concept and master planning, we work on the spatial layout as a follow-up of that and also focus on the experience design in the hospital. So that would eventually help you take care of the efficient functional utilization of empty spaces within the hospital. And also, as I was pointing out on the traffic movement, so it is directly pertaining to not only the patients, but also the staff working within the hospital. Once you have the plan ready for your concept stage, once you're there to give a final go-ahead and are there in the construction, what we effectively can derive out of all these is how we can help you strategically source all the important items that you're needing for a project. And that would be including medical equipment, that will be including surgical instruments, all the support infrastructure, including hospital furnitures, including non-medical furnitures, including all the ambulatory care equipment requirement, or maybe the community outreach programs for that matter. Now, so this phase would deal with what we do when there is construction already in place after the design implementation has been taken care of. And that would include the project management consulting part, in which we plan how and in what phases, what all parts of the hospital would come up, how many weeks for a particular capacity to be built up. And if there is a lag, we keep on a regular monitor on that. If there is a lag, if a facility is running behind schedule, we want to adjust that, how we can do. And if required, if there's a huge lag, we want to kind of have a PERT crashing. We can probably give you some value engineering advice also. Maybe you can construct a facility in a different way to minimize time and maybe save cost as well. And we do quality audits as well, apart from this, which would tell you if the construction is going as per the intended plan to do. If there is any shortcoming in the kind of material use, if there is any improper assembling of prefabricated items, etc. And then lastly, the project management consulting service also on a regular basis keeps safety as a priority and keeps a check on that. So safety audits become an essential part of the project management consulting. So when this is the last phase before just the launch of the hospital, the commissioning of the hospital, we help you prepare. The pre-commissioning guidelines are there. We work with a team to help ensure that all the things which are needed for a dry run, which are needed to the actual launch of the hospital, are in place, which would eventually help you minimize the time lag, hence fixed deadline of launch. And then after the launch has happened, for a certain time, there's a hand-holding also, in which we monitor, wherein you are actually delivering as per your promised timelines, as per the performance levels promised. And if there is any lag, there is a team which will help you internally how to fix those gaps, how to bring those back on track, and any kind of consulting which is required in that are provided in this phase. So all in all, what touches base with what services we do offer on a totality, we work on enhancing the experiences. We worked on a lot of workflow optimizations which would help you increase the efficiency and eventually also help you achieve the financial metrics, which is the core of any business, by improving efficiency, by reducing any kind of waste which is present in the system. I'll quickly take you through one of the customer testimonials of what services we have done so far.
Is evolving at such a rapid pace. So the pace of change that we're experiencing are some of the most significant challenges that we're having today. And what do we anticipate our needs will be in 5 years, 10 years?
Those strategic design team is helping its customers by designing tomorrow in mind, addressing the many clinical, operational, technological, and experiential changes at work.
The technological advances, new paradigms of clinical care, that's what we're driving towards. And that's why our partnership with Philips is so important.
Philips strategic design team is helping customers like Children's Hospital and Medical Center in Omaha to be ready for healthcare's next transformation, because they're creating the next generation technology that will shape and enable.
We really felt like it was critical to have another set of expert eyes to help us to really design areas that are reflective of the need of our modern patient base.
My favorite moment was just pulling my team together and giving them a voice as we walked through the patient experience and as we walked through what our new space would look like. My experience in working with Philips is that they've been collaborative and they have heard the voice of our referring providers, our staff, our patients, and our families. I've learned things throughout this process working with the design team around really making flexible and suitable environments so that you can plan for the future if in fact this is a department change.
The workflows that we developed helped us to assure that our patients and their families had the best experience as they were impacted by their care of the organization. I would say our relationship with Philips has been a very gratifying one. They're working in a co-creation model that is really allowing us to be absolutely innovative and creative. All of these things, Philips has helped us think about how we're going to deliver care for the next 10 to 20 years. Fantastic partnership.
Philips' mission is to improve the lives of 3 billion people by the year 2030. Partnering closely with customers like Children's Hospital is how we'll get there. By challenging assumptions, by putting people first, and by designing tomorrow's high-performing health systems today.
So that is something which we keep on kind of bragging. A lot of similar customer testimonials abroad. Talking about Philips' footprint in India, we have a reasonable presence down south and the eastern part and western part also. North we're trying to consolidate now, but there's an incremental engagement going on right now, which will be helping us to improve the current mix as of now. So one quick case study apart from the one which you saw at the international level, I would want to kind of share here is the Kalinga Institute of Medical Sciences case study at Bhubaneswar in Odisha, which had a lot of constraints as compared to a new project coming up, because it was an existing building in which a lot of retrofitting had to be done. And right now we have, apart from the 150 bedded hospital coming up there, another 200 beds being added sooner in the newer block. It's an example and testimonial to go and prove that what capabilities we can bring on table to transform an existing hospital which was not used to seeing any corporate setup, which was built up to cater to people who were expecting services in not so organized and arranged manner, and how we have been able to transform that. And on the basis of that, we have been also been given a task to add up a new block which would be taking care of an oncology section based on the current latest corporate guidelines of hospitals. It's very interesting to see that. Some of examples of our global projects are also here. Majorly you would be seeing Netherlands work, because our Eindhoven office has presence there and has the hardest and strongest capabilities present. But there are a couple of Belgium projects also to be seen. My time is up, so I'll quickly wrap up. I'll take one quick question, if at all. Yep.
conservation, LEED certification, I think you have not covered. I think
Correct.
while you are constructing KIMS, that is Kalinga Institute of Medical Sciences, I understand, you must have taken care, but you have not covered. Fire safety is a very important thing.
Yes. So
Biomedical waste management is
Agree.
very, the certification, be it Indian certification, GRIHA, or be it the international certification, LEED certification, energy conservation, and above all, National Building Corporation Code, National Building Codes, you must also refer when you build hospitals in India. Thank you.
Yeah, I agree. So one thing which is there is that that hospital did not have any fire license when we went there, but it's not something which we kind of brag about with the client. It's now there with them. Talking about all the certifications that we talked about, National Building Code and all the LEED certifications are an integral part of the way we design a hospital. So even if you go for a LEED star certified building or not, our standards are mostly met with. But we provide that as an add-on service to whatever design you would want. So if you want us to give you a design which is compliant to that and want to apply for that, there's a separate fee involved, but we do not involve that and include that in our design service. But our standards are ensuring that if you want to go for that, you would not have to majorly tweak your design to achieve that. Regarding the statutory compliance and everything, we work closely with the client's body because we don't take onus of providing statutory compliances as such. The design can be vetted, design can be following all the guidelines, but getting the statutory compliance certificates is the responsibility of the person who's owning the hospital. So it is from the client side, and hence it's not present here.
Again, I will not aim to contradict you. Fact is, I have been involved in 6 aims of the India. First, no, they are statutory. The problem is when you, as you said, hand-holding, just before commissioning, you need OC, the occupation certificate. Unfortunately, that time, I built a big hospital in my own institute at PJ, a 200-bedded emergency. The agency built the hospital when we said, we need an occupation certificate before we commission it. They said it's our responsibility. They did not build the fire escape routes. They didn't build the ETP, the effluent treatment plant. And when we came to it, we said it is impossible to, then we have to incur huge amount of money. I don't want to share that. The problem is, when you get OC is a problem. I think that should be taken care of. Even in your presentation, that should be covered. Because
correct.
people should not be taken for a ride. Thank you.
So see, occupational certificate is definitely the most important, the single largest thing which you need to kind of operate and launch a hospital. Obviously, other compliances go along with that. But basis that, you get an occupational certificate. You don't have a fire license, you don't get an operation certificate. So, as I said before, this is not in the scope of the company right now, which we operate as a service, because we can guide you and we can keep you on the track that you need to do that before this thing happens, and kind of this is the four-week timeline that you need to follow. That is one. So this is something the client has to do. We can't just tell them as a consultant. We cannot ask, kind of take onus and directly apply it to the government. That is one. Second of all, so I have to answer the question. Second of all the licensing part and everything, in terms of any fee to be paid or any such other licensing, has to be in the scope of the client. So we can only assist, but we cannot take the onus of that. We can advise.